You're tuned into the Mid Morning Talk with me, Fazila Isaac, on Salam Media. Now, on top of everything that women have to go through, we still have our hormones that we have to deal with as well. One of the topics that is very, very interesting to me is polycystic ovary syndrome, which I think not many people have much information about. So we joined today by Nutritional Solutions Claire Yelsing Strydom, who I have it on good authority is really, really excellent when it comes to this field and dealing with this particular ailment. Thank you for joining us, Claire.
Thanks so much for having me, and hello to all your listeners.
So, coming into something like PCOS, I myself have experienced this. What can be defined as PCOS? What do we define PCOS as? Before we get to that, let us just get a brief intro into who you are.
Okay. So I'm a registered dietitian. I've been in clinical practice for 18 years now, and I myself have PCOS. That's why it's so close to my heart. I love working with women with PCOS because it's such a complex condition in terms of all the overlaps that we see. So yeah, I'm based in Johannesburg, but I see patients from all over the world actually. And I love nutrition because it has a small thing with nutrition can have such a big impact in human health. So it's something I'm really passionate about, and I love working in the PCOS nutrition space a lot.
And so yes, going into PCOS itself, what is it defined as? How do we define PCOS?
So PCOS is one of the most common endocrine and metabolic disorders in premenopausal women, and it results in fertility outcome. It's not a fertility condition, but you're basically getting an overlap of metabolic and endocrine issues. So we see combinations of inflammation, issues with insulin resistance, issues with nutrient deficiencies within this condition, elevation in androgens, which is a male hormone, and we get this combination all mixed together, and we get the syndrome. So it's a little bit tricky because it's all these different areas overlapping, and then these nutrient deficiencies are often very common in PCOS as well.
And I know it's there's obviously a list of symptoms that you would need to look at. What are some of these symptoms in order for you to get that diagnosis?
I can break it up for you. So when we look at diagnostic criteria of PCOS, there's 3 criteria. And of the 3, if you've got 2 of these 3, it's very likely that you have PCOS. Okay, so the first one is if you have oligo anovulation. So if you're not having a regular period, and you might say, well, what's regular? So shorter than 21 days or longer than 35 days is classified as an irregular period or anovulation. Okay, so if you're not getting a regular period, that's already 1. Number 2 is if you get cysts on the ovary, so actually seeing the picture of ovarian dysfunction, or we call them polycystic ovaries, and that's by the gynae can see that, or they see that on a scan. You don't have to have cysts on the ovaries to have polycystic ovarian syndrome. Very important. Okay, so you can have a normal presenting ovary but be missing periods, and then it's clinical or biochemical markers of hyperandrogenism. So if we just take this down a step, it's when the androgen levels are high. We can test this in a blood test, or you can see it. You can clinically see it, and those symptoms are hirsutism. So it is hair growth down the central midline of the body. So chin, in the chest area, on the belly button, in the central midline, it's more hair growth. It's acne, and it's predominant acne here. We see it on the jawline. It's on the jawline, the lower sort of cheek jawline area. That acne, the hirsutism are very clear signs of hyperandrogenism. Also balding. You get male pattern hair loss with male pattern hair growth. So you're growing hair in all the wrong places basically, and losing it in the places you don't want to lose it. So if you've got 2 of the 3, it's very likely that you have PCOS, and your GP can diagnose it, your gynae can diagnose it, but that's what you're going to look out for.
And what is actually happening in a woman's body when she has PCOS?
So you get a combination of different things, and this is also what makes it a little bit more tricky, is when we do blood tests on women, we look at inflammatory markers, we look at their hormones, we look at their sort of insulin resistance picture. We check their thyroid, we check their nutrient levels. So you can have a mixed match. You'll often see on Instagram and all these social media apps what type of PCOS you have. You actually probably most of the time have combinations of, we don't actually put it into a category, because you can have overlaps. What your PCOS looks like over a lifetime can also shift from more insulin focused to more inflammatory. It changes. So often we see high inflammation in these women. Insulin levels are really, really elevated in a big percentage of these women. You also get lean PCOS. So we see a lot of weight gain in women with PCOS. They have irregular cycles. They often, when they do have cycles, have very heavy menstrual cycles in some women. We know that women with PCOS have a 19-fold increase of having a magnesium deficiency. So this can affect their anxiety. It can affect their sleep quality. They don't sleep well. Now they feel worse, and they often battle with exhaustion. They'll say to me, I'm exhausted, when they come and sit with me. And in multiple patients, they'll have vitamin D deficiency and B12 deficiency and magnesium deficiency. It's this cluster, because a lot of the women with PCOS battle with their weight. So they've been told, eat less, exercise more. They're hardly eating. They are so starved. They're so malnourished often by the time I see them. That we really have to work on getting the nutrients in. So it's a collection of different symptoms and signs, and I think it struggles for a lot of women with PCOS with that fatigue. I mean, if women with PCOS are probably sitting there going, yes, 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 as we're going through the list.
And then 100%, like I said, I'm also part of that. I do have PCOS. So, you see all of these signs and symptoms, but you don't actually think that that's what it is. Because if you're going to go to a gynae or whoever you're going to go and see, even just your regular GP, they're not going to immediately go for a PCOS diagnosis. There's so many other things that they would tell you before actually reaching and saying, okay, you know what, I think this is what it is, and this is how we should assist you. And what are the ages that are affected by this particular hormone disorder?
Okay, so this is the perfect opportunity to touch on this. I want to lose my mind when I see on social media, reverse your PCOS. It's going nowhere. It is a genetic predisposition that you've got. You can treat it so well that you don't have any clinical symptoms, any signs. But this condition basically starts in puberty. It already starts in puberty. So a lot of young girls have irregular cycles, lots of acne, and they get put on the pill when they are 16 by the dermatologist for the acne. That's how it often starts, okay? But PCOS will be with you for the rest of your life. It's a lifelong chronic illness, okay? It requires medical nutrition therapy, and you can manage it really, really well. How it impacts your life over various stages as a female differ. So in your teenage years, often it's the acne that really affects. The weight gain is an issue for a lot of women over the entire period of their lives. Then in the reproductive years, fertility often becomes the main sort of problem, and this is where a lot of women actually get diagnosed. Like you said, often people don't go to that PCOS diagnosis. We know from literature that women will see 5 doctors on average before they get their correct diagnosis of PCOS. Okay, so which is quite hectic. And then post-menopausal, we see elevations in increased risk for cardiovascular conditions, diabetes linked with the PCOS, also high risk for gestational diabetes.
And also, what are some of the the recommended treatments, the dietary solutions that could assist with because like you said, this is not going anywhere. It's there, and it is something that you're gonna have to learn to obviously make lifestyle changes in order for you to deal with this and to make it more bearable and just everything that has to do with this. So what are some of the treatments that one can get, and dietary solutions, what kind of exercises, etc., because I know some are harmful, of course, that's gonna obviously cause that. So what can help a woman who is struggling with PCOS?
So my best way to describe this is PCOS is like a 1,000-piece puzzle. Okay, and the 1,000-piece puzzle is unique to you as an individual. So starting with the nutrition side of things, when we sit with the patient, we look at your your normal day-to-day living, the structures in your home. Are you married? Do you have kids? How does that affect your eating? We look at your cultural food, traditions around food choices, what you enjoy. We need to make sure we're getting adequate protein. We want lean proteins. We want more like monounsaturated fats, very high intake of vegetables. I get my PCOS patients to eat at least 4 cups of vegetables every single day, lots of color, lots of variety. So from a nutrition perspective, we need to get. I often find women are under eating when I see them for the first time for PCOS. They're not getting the nourishment in that they need, and often there's multiple nutrient deficiencies that we need to treat. That's the nutrition part. Okay, we also have to look at the hormonal picture, and various medications sometimes get used here. We use inositol therapy, which is our first line treatment for PCOS. So if a woman is diagnosed with PCOS, we put them onto inositols, and we use 4,000 milligrams of myo-inositol with 100 milligrams of d-chiro-inositol, because that combination has a therapeutic impact, and we've seen really good results over a long period of time. Now we're seeing this in big clinical trials, systematic reviews, meta-analysis, etc., in the literature when it comes to the nutritional sort of supplementation and the hormones. We also have pharmacotherapy. So there are new medications on the market. We use different types of GLP-1 receptor agonists, or sometimes used together with metformins. There are different drug regimens. And then we also have psychology that often plays a role with a lot of women with PCOS battling with mental health conditions like anxiety, like depression. So you generally need a team. We work as a team of healthcare practitioners. So when I in my case, I work with PCOS a lot. So I do look at the hormones, I look at the metabolic markers, I look at the nutrients, I look at all of that. But then I communicate with the patient's gynae or GP, whoever's the referring doctor. And then I screen my patients for anxiety. For anxiety and depression, and I would then refer them onto a psychologist and necessary a psychiatrist. So it really depends what the biggest issues are for that individual person, what stage of their life they're in, if they're trying to conceive, or if they're postmenopausal, or if they're a 19-year-old teenager with acne, PCOS, missed cycles, trying to lose weight. It differs depending on the individual, but that's, in a nutshell, that's what we look at.
Yeah. I know there are some, like, for example, I came across PCOS, and that was literally all of the supplement requirements are on that particular one, and it works so beautifully. So,
Yeah.
like you said, it's not just one aspect. There's so many other things come into it, obviously your mindset, the food that you eat, exercising, there must be movement, your supplements. So it really can be maintained, but it obviously takes a lot of support to get there. And you did touch on, of course, the mental well-being of the patients as well, or of somebody who has PCOS. So of course, I've seen a lot of posts where women, especially that have the infertility problem with this, I think they really are in a bad space, and it's so sad that that has happened. However, does it mean that because you have PCOS, you cannot then conceive?
No, it does not mean that. And if you get told that by a health professional, that's just not okay. It's terrible when you get given that information, and that's not true.
Yeah.
So we can correct a lot of these problems with lifestyle, diet. The inositols are doing amazing things. I had a patient this morning that let me know that she's pregnant, and we're so thrilled, and she's PCOS. She was saving up for IVF, and we've corrected, and she had issues with thyroid, with insulin, with vitamin D, with magnesium, lots, and all those levels have normalized, and now she's pregnant. So if you were told by somebody that you can't have a baby because you have PCOS, please don't get a new practitioner. That's not the case. Okay, you need to change who you're dealing with, and work with someone who's knowledgeable in the PCOS space.
Yeah, and I think that is key. That is absolutely what you just said, is absolutely it. Because a lot of which is going to lead me to my next question as well. A lot of practitioners, again, from starting with giving you that diagnosis, is the last thing that they actually go towards, and then when
Yes.
it comes to the treatment, etc., like you said, just change that doctor who's going to give you that diagnosis. It's just not, that prognosis is just not true. It
Yeah.
happens. People go through that. With the changes that you said, the recommendations that you've made, it absolutely can bring you back on, to the path. Speaking on that, where should someone seek for help when they do have a PCOS diagnosis? You have your gynecologist and your endocrinologist as well,
Yeah.
nutritionist. So, do you see them all as a team, like you suggested, or
Yeah.
can you just go to one person and just get the treatment? What
So it
can you do?
depends.
What
It
can
depends. It depends where you start. I mean, I would definitely say the gynecologist is probably really important. The endocrinologist also. So it's not like the one or the other. Often we work with multiple teams with patients. But I'd say if you're battling with fatigue and you're battling with your nutrition, and you can start with lifestyle intervention, because if you've got the diagnosis already, seeing a dietitian that has a special interest in PCOS would be very beneficial, because we would be dealing with all those different areas. As a dietitian, once I've seen a patient that has come to me, let's say their GP diagnosed them, I'll check. Have you seen your gynecologist? When last did you do a pap smear? Those things are important. We also can't have a patient that doesn't have a period for a year. There's risks associated with like longer periods of time with no menstrual cycle. So I specifically work very closely with gynecologists. I work with multiple gynecologists, and we work together on our patients. And then we often have the addition of a psychologist. So you could start at any one of those points, but I would recommend, if you do have PCOS, do your research, find out in your area, or what's quite nice is that most of the experts also do online sessions for patients, but get somebody that's knowledgeable in this space to help guide you through the journey, because it's stressful if you going back and forth and just getting stuck, because I think a lot of women do feel stuck with this condition.
Yeah, it's quite hectic. It's you come to a point where you when it comes to something like this, there's you stick to a certain diet or lifestyle, and then sometimes you just revert back to your old ways, and then there's that fear that, now I've gone back already, and then you find that, okay, now all of the problems are back again. The
Yeah.
face is acting up all over again. So it really is something that it does play on your emotions, as a woman, and then having to deal with these different things that are happening every month. When are you actually going to ovulate? When is it are you going to get your period? When like, it's just endless. I see a lot of women in these support groups, quite a bit of support groups, and they
Yeah.
speak on this. It's really
Mhm.
something that does. I love the fact that you do work with a group and a team who are going to be assisting with the different aspects of this particular
Yeah.
illness. That's actually quite insightful, I should say.
You know what I want to stress? You must never be on diet.
Yeah.
Okay, I don't want my patients on diet. You don't have to cut carbs. You don't have to cut dairy. You don't have to cut gluten. That is rubbish. That is not necessary. Okay, you don't have to do
This
that.
is literally the
Okay,
first
so
time I've heard that.
yeah, so even in PCOS, we know that we need fiber in the diet. So a diet with adequate fiber will actually downregulate inflammation and has benefits for PCOS, which is an inflammatory condition. If you just cut carbs, you won't get fiber. So the quality of carbohydrates, the fiber, if you take something like bulgur wheat, you're getting 18 grams of fiber per 100 gram. That's going to give you benefit. A normal couscous, not going to give you benefit, still too refined. Okay, so we've
Yes.
got to start understanding there's a big knowledge gap that needs to be corrected in the space. Dairy free is only if the patient has high androgens with a lot of acne, and then it's not no dairy, it's different types of dairy, and maybe using things like a yogurt as opposed to a milk, and changing the type of milk. To blanketly make statements on social media to say we must cut dairy out completely because we have PCOS is not evidence-based. Okay, you do not have
And
to
there's
have a
so much of
gluten-free diet.
it.
It's too much, and unfortunately, that space is not regulated as it should be. If you see a dietitian in South Africa for your PCOS, they must be registered. They can't call themselves a health coach or nutritionist. You may not use those terms in South Africa if you are not a medical profession working in the dietetic space and you have a BSc dietetics degree and you're registered with the Health Professionals Council of South Africa. So ladies, beware. Check, ask the person that you're going to see, I want your DT number. They should have their HPCSA certificate and degree with their qualifications hanging in their office. The reality is, in the nutrition space, so many people go, well, I had PCOS, I lost weight. Let me just tell everyone what I did.
Yes.
It's not allowed.
Yes.
That's illegal. Okay, it's not just maybe not okay. And the reality is, so many women are going into these awful diets, and it's like you said. But then, Claire, if you're going to go off the diet, you don't have to be on diet. We need to look at, what do you like to eat? How do we start shifting those habits? How do we still include, if you like a chocolate, then have a chocolate, but how are we going to do it that it's not spiking your glucose and causing issues for you long term? Not, oh, never chocolate for you ever again. That's not going to work. It's not sustainable. And then you even feel more guilty because the little girl on the Instagram was telling you no carb, no dairy, no gluten. Now here you are. I mean, I once had a patient say to me, Claire, I can't have a baby because I eat bread. And I can't stop eating bread, and that's why I don't have a baby. I'm like, what? She's like, yeah, because it's gluten and it's carb. I'm like, that is rubbish. Said person has had a baby and did eat bread, and it's all fine.
Yeah.
So,
And like you said, you know what? Seek the assistance that is correct assistance. Get
yeah.
that advice is, I think, is absolutely key. How can people make contact with you?
So you can contact me on Instagram. It's Dietitian Claire. So Dietitian DIETITIAN. So Dietitian Claire on Instagram. The practice that I'm part of is Nutritional Solutions. So you can literally Google Nutritional Solutions and get in touch with my office, and they can assist you if you want to have a consultation and start your journey to change your PCOS story.
Thank you so much. That was really, really insightful. You know, there's so much that I've just learned from you. And like I said, I've been, speaking to people and going through all of this for so many years. And you really, really debunked so many myths when it comes to something like this. You know, thank you so much for that.
It's
And thank you so much for taking the time to join us today.
It's such a pleasure. And I share a lot of free content on my Instagram, a lot for patients or ladies with PCOS. So, if you want to learn more, there's lots of information there that you can go and get for free on my social media. Yeah.
We will do exactly that. Thank you so much. Hey, have a great
It's a
afternoon.
pleasure. Thank you for having me. All the best. Bye.
Bye. That was Claire Julsing Strydom, who is actually assisting so many women when it comes to PCOS. So we're just going to take a quick short break. And when we come back, we're going to be speaking to Sheikh Rahim Nkumane, who's going to be telling us about the Youth and Adolescent Center real quick. Stay tuned.